Welcome, MedHeads. We're going to have another discussion here live on this Thursday evening. I'd like to talk a little bit about the video coming out tomorrow. And for those who really want to get deep into the discussion, they're watching this after the fact, you might want to jump ahead to about 2 minutes into the video. This is a live video as it's being done. There are comments that will be responded to from people who are watching it live. If you want to make sure that you don't miss future live discussions like this, make sure to go to the Auburn Medical Group YouTube channel on your device, and when you see the channel page, hit the little bell icon and make sure you're subscribed. Then you can adjust your notification options. Right now we want to say hello to Funk Neon Vivo. Hello, we're glad to have you joining us. We're also glad to have Bianca Dye already here, and Brianna McMillan from Arkansas, and Ashley England saying hello. Thank you all of you for already letting us know that you're out there and being a part of this live discussion. The Crazy Cat Lady from Tulsa, and El D'Angelo saying hi, and Gian Leggett from, I forgot where you're from, saying hi, Dr. Vaughan. Lulabelle Ortiz from Miami, 3 a.m. at Funk Neon Vivo's country, wherever that is. Adam Usher, hi from Arkansas also. And if there's just too many comments and I'm not getting to yours and you want to make sure you get through, you can always use Super Chat unless you're on an iPad or an iPhone. But everybody else can use the little $ icon if you need to get through. Jane Adams from Richmond, Virginia is also being a part of this. We are glad to have all of you joining our discussion. We're going to be talking about Bell's palsy, and that's because it has something to do with tomorrow's produced video that's going to be coming out. And also, Selena Glover from Vegas is also joining us. Jonah is saying hello to everybody. We're glad to have all of you there. Bianca, it's after 4 a.m. in the UK. We'll be sleeping very soon. Okay, maybe this won't go too long then. Just for you. John Leggett is in Fort Leavenworth, Kansas. And Bernadette Blair's in Pittsburgh. Dee Elliott is in Houston, Texas. We're glad to have all of you be a part of this. The reason that we're talking about Bell's palsy is because tomorrow you'll see a video of a patient who's actually recovering from it. So you won't be able to see the dramatic Bell's palsy. In fact, I don't even know if I can, mimic what Bell's palsy looks like here. I'll try. It would be like if you told somebody with Bell's palsy to smile, it would look something like, let me see if I can do it here. I'm looking at the reflection. Like that, something like that, because one side can go up, the other side's just not moving. So they're both the upper and lower parts of the face are either paralyzed or weakened because of swelling of the facial nerve. And what we discovered for the first time, both Dr. Gwain and myself, this week, was that there can be a sensory component to a Bell's palsy. We usually think of the facial nerve as being involved in movement of facial muscles, and it does control the muscles of facial expression. But a component of it is sensory as it goes through the ear canal, and part of the tympanic membrane is actually innervated for sensation by the facial nerve. The rest of the face and even other parts of the ear canal, among other nerves, are mostly innervated by the trigeminal nerve, the fifth cranial nerve, which kind of is significant when it comes to shingles in the face, because you can see these three different branches depending on which one is affected by shingles. You'll see like shingles just like this, or across here, right at the eye level there, and up here, up to about the midline, and midline here. That's the three branches of the trigeminal nerve. Facial nerve, muscles that move the eyelid, muscles that help you to make expressions with your face. People won't be able to close their eye tightly, so it can get dry. You need to give them medicine to help to keep the eye from drying out. They'll drool out of their mouth because it doesn't close by itself. A lot of times you have to distinguish it from stroke. Stroke, typically you will have the upper part of the face still able to move and not the lower, and that has to do with the way the muscles are innervated. The facial nerve is duplicated on both sides of the head for the upper part. You actually have the right nerve going to both the right and the left for the upper, and then the lower is just the one side. So people can have a stroke where the injury is in the brain, but because of this duplication of the nerves that happens, I have to think through, where's the duplication at? Is it on the upper or the lower? Somebody remembers, let me know here. I did actually study up You'll get the lower but not the upper paralysis. Anyway, that's a way to typically tell stroke. It's not 100% though, because you can still have a stroke that affects the upper on one side. But we won't get into the complicated anatomy that I actually honestly don't remember that well from 25 years ago. The other things that can be related to it that you have to consider are, because this happened to me once also, and that's Lyme disease. Lyme disease can actually cause a Bell's palsy. So there's different things that can cause this swelling of the facial nerve somewhere on its track. And what we find out in tomorrow's video is that this patient has exquisite sensitivity where the facial nerve is innervating the auditory canal, the external ear canal, or actually not just external. Exquisitely sensitive to what you see Dr. Gawain do tomorrow, 4, so be there. 4 o'clock p.m. Also, if you guys have not subscribed to Dr. Gawain's blog, it's at drgreenknight.com. Dr. Green Knight, D-R-G-R-E-E-N-K-N-I-G-H-T, Dr. Green Knight. Be sure to check out his blog because it's good. Okay, so somebody wants to know, L. D'Angelo wants to know if, sorry I wasn't participating in your conversation there, you guys. Boy, you guys really have a lot of talk about medical topics that are, I guess you'd say, off topic. But I'm glad that you guys cover for each other there. Looking to see if there's anything here about our Bell's palsy subject. I see that Julie has suffered Bell's palsy and had Botox to control this. Wow. Typically Bell's palsy resolves, so that's something that has been going on for 7 years for Julie Hims. And Crazy Cat Lady and Tulsa saying that her cousin had Bell's palsy once. Thought he had a stroke. Yes. Sometimes it can be difficult to tell the two apart. So there's a lot that has to be taken into account on that. Severe pain on the right side of the face, so obviously that's not Bell's palsy, but maybe related to the trigeminal nerve, like trigeminal neuralgia. We'll have to talk about that. Rose high. And John was given an antiviral, which is appropriate if we're thinking that it might be, whatever your symptoms are, might be related to a viral infection like shingles. So wanted to get that out there and tell you a little bit more about the video tomorrow because there's not much explanation in the video at all. In fact, it wasn't until after the patient had so much pain on the side she had Bell's palsy on that we did the investigation and found that, wow, that's a thing, having pain in the ear where the facial nerve innervates it when you have a Bell's palsy. So be sure to see that. Those of you who are interested, do check out the Auburn Medical Group on Amazon Prime. Anyone who has Amazon Prime in either the U.S., possibly England too, you guys can see tomorrow's video as soon as it comes up. I've already submitted it to Amazon Prime, so it may be that in future you might actually see some videos on Amazon Prime before they come out on YouTube. And our patrons won't get it any earlier this time, although sometimes patrons will get extended cuts like last week, last Friday's video. The patrons get to see the extended version of that rather than the shortened one that's just available on YouTube. And also the extended one was also on our Amazon Prime. Season 2 is Prime. Prime is working for those of you that found that, hey, I have Prime, but it's trying to charge me for the video on Season 1. Season 2, we got it working. We're still working on Season 1. Thank you guys for all of your support. We look forward to having discussion in the comments of tomorrow's video with you. Until next time, Dr. Mark Vaughan telling all of you to stay in good health.